Thanks, Bob. You did say that there were physicians associates now coming into GP practices. How would you say that people who are going for a GP appointment would recognise that they've got a physician's associate rather than a GP? And how can they actually deal with that in relation to saying, well, I actually made the GP's appointment, so I want to see a GP. I don't want to see a physician's associate. What is the best way for them to deal with that?
Yeah, so more often than not, the physician's associates will not identify themselves as such. There isn't clear signing very often. And to be honest, patients are waiting so long just to see anybody, they're often quite grateful. There is also the majority of people don't like confrontation, are deferential to health staff, and don't really want to have this awkward question about, are you qualified adequately enough to be the person to see me? The problem is the government is giving them this stare. The government is deliberately creating confusion, blurring the boundaries, and unfortunately people more often than not will just accept what they're given. If it's a choice between waiting longer, having a telephone call or doing an email consultation, they'd rather see any person face to face. But what they don't know, actually, it's not a doctor, and there is this degradation in terms of the quality and medical experience. And also, if you're lucky enough to have a long sort of continuity of care with a particular doctor, well, that is going to be increasingly, vanishingly rare to access. People are losing something that they didn't really quite get their head around how valuable it was. And there's a lot of research evidence to say, people who have continuity of care with a main caregiver actually have the best outcomes in terms of early diagnosis and prevention of early death.